Welcome back. You're with us on the Newstrack, and for this part of the broadcast, I want to focus on Mumbai and New York, two of the most important cities in the world and two hotbeds of the coronavirus globally. What are the similarities? What are the differences? So we put the India Today Data Intelligence Unit to track these two cities across parameters. Let me take you through what's similar and what's not. Mumbai at this moment has about 22,700 odd confirmed cases. New York has 1,91,650 confirmed cases. On a per million basis in Mumbai, it's 1,114 per million. In New York, it's about 10,900 per million. This is the percentage of cases in these cities vis-a-vis the national average. So New York has about 12% of America's total cases. Mumbai has 21.3% of the total cases in India. So that's a fair amount. 1 in 5 of all the cases of coronavirus in India come from Mumbai alone. However, what's problematic is from the mid part of this month, there have been more daily active cases in Mumbai than there are in New York. So this really, the 12th of May is the inflection point. Till then, the yellow line. So can I get our producers to come close? Come close so that you can see this. This yellow line is the line that represents New York. Till the middle of the month, New York had way more cases because at the beginning of the month, New York had about 1,800 cases. Mumbai had 751. As the month wore on, you've got now Mumbai with 1,400 daily new cases and New York only 376. So this is now turning and changing, and that's really why we're doing this conversation on the Newstrack. Here is the daily reported deaths. Remember again, yellow is New York, blue is Mumbai. At the start of the month, New York had 173 daily deaths. Mumbai had only 5. Here again, towards I think the 11th of May, the number of cases in Mumbai overtook New York. Just on the 20th of May, when we last tabulated, Mumbai has 43 deaths. New York on a daily basis has 9. I want to show you this report that we put together on the similarities and the differences, and then we'll have a doctor each from Mumbai and New York to try and explain the similarities, the differences, and most importantly, the lessons Mumbai can learn from New York's example. I've got Dr. Rajveer Purohit, Director of the Mount Sinai Hospital, joining us from New York. Dr. Rajesh Parikh is the Director of the Medical Research at Jaslok Hospital. But before that, take a look at this report.
Far apart, yet very similar. New York and Mumbai. Financial and cultural hotspots. High-rise buildings. Fast-paced life. Home to immigrants. Uber rich to the poorest of the poor. And today, 12,530 kilometers apart, both are ravaged by the deadly coronavirus. It is the continuing trail of destruction and devastation that joins them together. Both are the worst hit cities in their countries.
Number of hospitalizations are down, so that's good news. Not down a lot, but down. I'll take it. Net change is down. Net change in intubations is down. The number of new cases per day is down by 1. Not great, but I'll take it. It's going in the right direction.
अजूनही शृंखला आपण तोडली जरी नसली तरी एक गोष्ट नक्की की त्याच्या वाढीवरती गुणाकारावरती नियंत्रण आपण हे नक्की ठेवलेले आहे.
According to the last census, Mumbai is roughly half the size of New York City but has more than 1.5 times the population. But both cities are also densely populated. While New York City has close to 10,000 inhabitants in 1 square kilometer area, in Mumbai it is a staggering 32,303, making it impossible to maintain social distancing. resulting in the rapid spread of the virus.
If you don't do lockdown, the virus spreads exponentially. I gave you a number that's a shocking number: 40 days with full contact, and you get some number multiplied by 10 to the power of 17. More than the world's population by 100-fold.
With close to 2 million positive cases and over 16,000 deaths, New York's cumulative picture is far worse. In fact, the cumulative deaths in New York are a little less than Mumbai's confirmed cases. When the cases peaked in New York, the city battled a lack of hospital beds, ventilators and PPE. Today in Mumbai, civic hospitals are running short of medicines, equipment, staff and hospital beds.
बेड पे 3 पेशेंट और जैसे बेड पे जब पेशेंट मरता है उनको भी इन लोग जल्दी से फटक से लेके नहीं जाते। नॉर्मल पेशेंट के पास 4-4, 10-10 घंटा उधर बॉडी रखते।
But both the cities are at different stages of the virus cycle. While the worst seems to be over in New York, United States of America, infections in Mumbai, India, continue to rise at an alarming rate, triggering concerns about Maximum City heading on a trajectory similar to that of New York City. While New York is gradually starting to lift restrictions, Mumbai will remain under strict lockdown at least till the end of May.
Mumbai, New York, two of the most iconic cities of the world grappling with the same virus. Dr. Rajbir Purohit, director of the Mount Sinai Hospital in New York. Dr. Rajesh Parikh, director of medical research at the Just Lok Hospital in Mumbai. Dr. Parikh has worked at Johns Hopkins University, and Dr. Purohit traces his roots back to India. Dr. Purohit, what according to you are the lessons that Mumbai city can learn from New York City so that the number of deaths and cases that were reported in New York is not where Mumbai ends up at?
Well, first of all, Rahulji, thank you for having me here, and good evening to all of your viewers in India. I think in New York, as I've already talked about, the numbers are already on the decline. We're probably where we were about a month and a half ago before the boom had peaked, and we're on the bottom slope of the curve. There's a few things I think that have made New York better than expected. And at one point we expected 3 to 4 lakh log to be admitted to the hospitals. We were worried about having ventilators. We were worried about people dying from the lack of ventilators, and we never hit that point. It's clear that a few things have helped New York prevent it from the absolute disaster it could have been. So one thing is, for example, in New York, we had the social distancing was maintained very strictly. And people followed it. So if you went down to Main Street, you went to Times Square, the roads were all empty. And New York has the advantage as well of having people being able to maintain some social distancing from each other. India and Bombay specifically, that might be a little bit more difficult because of the density of housing. The other thing I think India may have going for it, and hopefully that, and not follow the full pattern of New York City, is that the population demographics are different. New York has a little bit of an older population than Bombay does, or Mumbai does, and older people tend to do worse than younger people. So you can get infected and not have severe symptoms, in part because you're younger and healthier and more able to resist the infection. The other thing I will say, and it's very important to recognize, is even though these numbers look like they're quite high, like over 1.5 lakh logs in New York have been admitted and have had the infection, the actual numbers are much higher. For example, a study showed that of 3,000 people in New York, they found that the infection rate in the city was 21% of the population had antibodies to COVID, suggesting that the penetration of the disease is far greater than we think it is. So if 21% of New York City had antibodies, that would suggest that up to 2.4 million or even higher numbers of patients actually had been exposed to COVID and actually had the disease. So we're looking at astronomical numbers, and in some ways, that would also mean that the death rate is much lower than we think, and the likelihood of having severe disease is much lower than you think it is.
Sure.
I think in some ways that's a cause for optimism.
But when things started to peak in New York, Dr. Rajesh Parikh, one of the things that helped New York City was just the amount of ICU beds, the hospitals, the medical infrastructure they were able to create. In Mumbai, we know that some parking lots, some stadia have been converted into makeshift COVID facilities. What's your sense of the graph in Mumbai in the way that it's going? Where do you see this go next? What do you believe needs to be done to ensure Mumbai doesn't end up as badly off as New York City was?
All right. There's one important variable which we should factor in when we compare graphs. And as you were speaking, I downloaded some graphs myself. But the important and critical variable is Mumbai is 10 days behind New York. The first case in New York was on the 1st of March. Ours was on the 11th of March. So I've downloaded a graph which factors in for this. And quite simply, I'm not sure if this is clear, but excuse me, quite simply looks at the day on which 50 cases occurred in each city. And so here in blue, you have New York City, and in red, we have Mumbai. So our starting point is the day at which each city had 50 cases. And then when we look at that, we see that things are not as grim as they might seem in Mumbai, because here we are 11 days behind New York. We are at day 53 over here. And excuse me for a minute. We are at day 53 here, at day 70. New York's graph started flattening. It reached a certain inflection point 10 days ago. And so following in the tracks of New York, we are not doing that bad. Keep in mind that New York has tested 61,000 people per million. Mumbai has tested 9,000 people per million. That's a monumental difference between the two cities. And as I've been saying time and again now on your channel for the last 2.5 months, that the number of cases is predicated on the number of tests we do. If we don't look for them, we are not going to find the cases. So that's a substantial difference, 61,000 and 9,000. New York City has 476 doctors, almost 500 doctors per million. And we have 54 doctors per million. Yet, on the other hand, for reasons partly explained by Dr. Purohit, that's the demographics of the two cities, and other factors not fully understood as yet, what is impressive is that the case fatality rate, CFR, that's the number of people who die per identified case, in Mumbai city is 3.55 compared to New York, where it's 10.25. Now, some people argue that it's possible deaths are being underreported in Mumbai. Now, it's not very easy to hide a lot of bodies when people die. And there was an interesting op-ed piece in the New York Times 3 days ago by Nicholas Kristof, in which he used a statistician, I'm blocking his name, from Harvard, who did an analysis of deaths in the months of April, May in the United States. And according to the mathematical model, there are probably 20,000 underreported deaths in the United States. So in the US, when the deaths were 90,000, the Harvard model computes them at about 110,000.
Okay.
And so there's a substantial difference.
What I want to ask you, Dr. Parikh, is this. We saw, for example, in Sion Hospital in Mumbai, there were dead bodies lying with patients, and that really scared everyone and spooked people about how the hospital facility was overrun. There have now been reports filed by our reporters that doctors are worried about medical capacity is being overrun. You're on the ground in Mumbai. How much capacity do you think we have? How many days will Mumbai's medical infrastructure be able to sustain the caseload that's coming in? And is enough being done in the interim to scale up the capacity that we have available?
It's hard to estimate how much is being done at present. Certainly, we're far better off than we were 10 days ago. That's not saying a whole lot, though. But, having worked in both countries, I worked and taught at the Johns Hopkins Hospital in Baltimore for 4 years prior to returning to India. There are clear differences between medical facilities in both countries, but let us not underestimate what is being done in India, what is being done in Mumbai. Demographics aside, a case fatality rate of 3.55 is substantially different from a case fatality rate of 10.25. Yes, the optics are terrible, dead bodies lying next to people who are living. But we have to understand that this is what would happen in an earthquake. This is what would happen in a tsunami. We are dealing with a natural disaster. Doctors, nurses, overstretched health workers, the government are dealing the best they can. And if you consider the 10-day lag, that we are 10 days behind New York, we're not doing badly. We're not doing that badly. And we are upgrading, I shouldn't say upgrading, but we are expanding the facilities, using schools, using spare capacity in stadia. In the circumstances, what we're doing is definitely yielding results comparable to what was in New York 10 days ago.
I'll leave it there. Dr. Rajesh Parekh, Dr. Rajbir Purohit, we wish you all the best. No one wants capacities to be overrun. No one wants to have dead bodies lying where patients are lying. This is exactly what we hope to prevent. And I think we need to hold on to hope that Dr. Parekh offers, that we're just 10 days behind if you look back at the first case, and the number of cases hasn't spiraled like it did in New York. And knock on wood, I hope it stays like that. Thank you very much, gentlemen, for joining me on this conversation.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.